The discussion continues. It's all about the 2025 budget. We've talked about real estate. We've talked about the budget itself. But now let's talk about healthcare. And as you can see, we've been through these numbers. 4.9 trillion for defense, 4.06 for infrastructure. Just talked about real estate. And now health. Health is wealth. Broccoli, orange juice, freshly squeezed, exercise, and all that. 2.48 trillion for health. Dr. Muyi Aina, Executive Director at the National Primary Healthcare Development Agency, joins us now from our Abuja studios. Dr. Aina, good morning to you. Thank you so much for joining us. I wanted to first get your thoughts on the amount that is being expended on healthcare and how that helps you and the Primary Healthcare Development Agency.
Thank you very much. It's really a pleasure to be here, as always. I think we're indeed very fortunate to have a leader in President Bola Ahmed Tinubu who prioritizes health. If you examine the figure of 2.48 billion naira, that's in fact a 50% increment at least over the 2024 budget. The 2024 budget in of itself was a remarkable jump from anything that the health sector had ever received before now. So that is a signal that the president is keeping true to his promise that he's going to prioritize health and he's going to ensure that Nigerians get the basic healthcare services that we need. Now, how does that touch primary healthcare? Of course, primary healthcare services is the bedrock of access for Nigerians. 60–70% of Nigerians get services that they need through the primary healthcare sector, whether it's in the public or the private sector. And there are a number of ways that this directly touches us. One is that if you think part of that money is a top line removal, which is a 1% of the Consolidated Revenue Fund, which goes to fund the Basic Healthcare Provision Fund. The Basic Healthcare Provision Fund is a guaranteed statutory pool of funds that goes directly to fund primary healthcare. It goes through 4 gateways. The National Primary Healthcare is one of the larger gateways. The National Health Insurance Authority is slightly larger, it's the largest, which pays for insurance, buys healthcare. You also have the National Centers for Disease Control and the National Emergency Transport Services gateways. And through these 4 gateways, the funds is disbursed through the states to the front lines, the health facilities, the local government agencies, to really implement basic services. That's one area that this money comes directly to strengthen primary health care. The other aspect is in the purchase of basic important commodities, immunization. So our vaccination program, I think, is in the hundreds of billions every year. I haven't checked the exact amount in this budget, but it's a big chunk that the government buys centrally, pays for some vaccines fully, but also co-finances certain vaccines with our partners, Gavi Alliance and others. So that's another way that this touches primary healthcare. Of course, that's outside of the budget that comes to primary healthcare agency, that some of that will go into development of primary healthcare, strengthening infrastructure, strengthening human resources, strengthening supply chain and all of that. But also the workforce, the salaries, of health workers, the salaries of the staff of the agencies. So these are some of the areas that this really goes directly to touch the primary healthcare services and builds on work that is ongoing. I think there's ongoing work around the revitalization of primary health centers. If you have been following what we're doing, we started, trying to improve the quality of the 8,400 basic healthcare provision fund supported facilities, but we are now also increasing the number to 17,600. So these resources will go into that, making sure they have the infrastructure, they have the equipment, they have the health workforce, they have power, reliable solar power, so that they can provide 24-hour service, but also accommodation, especially in rural areas for the health workers, so that they can stay there safely, work there safely, and be able to provide services for Nigerians for 24 hours in these locations.
Fantastic. Dr. Aina, thank you so much for that very effective breakdown there of how the budget is going to filter through and impact the primary healthcare centers. Looking ahead to 2025, are there any updates you want to share with our audience? What future projects or any developmental partnerships that you have that will boost the impact of your primary healthcare centers?
I think we spent the coordinating minister for health and social welfare and the minister of state, have led the sector to spend the last 1 year plus really setting the stage and building the foundations of an overhaul of the health sector at all levels. I think, everything from having the clear strategy with priorities to actually starting to demonstrate in real ways, the changes that we want Nigerians to see. I will start with a few things at the primary healthcare level. So, we started the revitalization of primary health centers, for example, in the first year, given the planning, given the resource mobilization and all of that. To date, we've been able to do just over 300, 310, 312, thereabouts. We already have started working with the states. The BOQs have been done, contracts are in process through a World Bank funded project of the federal government and the states, to revitalize another 3,000 facilities. Some of our partners, the Global Fund, are also investing resources to do a couple of hundred. So over the next 12 months, Nigerians can expect to see, a fundamental improvement. You will be able to feel it. You can go to a facility in your community where, in fact, you will be able to access the services that you need. I think that's one area. In the area of health workforce, also, we started the retraining of workers. The president promised to retrain 120,000 frontline health workers. We have done about 53,000 now. So over the next year, we'll be again working with the states to identify people that need this training and retraining them. But in addition to that, we're transitioning the health worker training at the basic healthcare level to more digitized, more self-directed, that is more up-to-date, so that it's more efficient, it's more cost-effective, not as costly. Health workers don't have to take as much time away from their workers. So Nigerians can expect to see that. We're also being very transparent with what we're doing. We have a dashboard where Nigerians can go online. It's https://phc.nphcda.gov.ng. Wherever you are in Nigeria, you can at least know the state of the health facilities around you, primary health centers. We started with the 8,400 that we assessed before and are now revitalizing. But we're in the field, as I speak with you, also assessing another 18,000 of them, so that we want to then add the next 9,000 or so we have 17,600, such that, by the time it's spread out in an intelligent way, it's not going to be evenly across the wards, but based on needs and gaps. Nigerians will be able to feel the impact of this. Outside of the primary healthcare system as well, actually, the national health insurance is also basic healthcare services. They're also increasing. This is the first year that they have added 2 million lives, insured lives in 1 year, to the health insurance. That number is going to be accelerated in 2025. There are things in the secondary and tertiary level as well. A lot of infrastructure upgrades in the federal medical centers.
Fantastic. Dr. Muyi Aina, we appreciate your time so much. Of course, the MD, Executive Director and CEO of the Nigeria Primary Healthcare Development Agency. Lots of impact there with respect to what's being spent on the budget going into healthcare. That's it.